Good afternoon, everyone. I'm Jacqueline Jones, the President and CEO of the Foundation for Child Development. It is the Foundation's pleasure to host this afternoon's webinar, Advancing Equity, Conducting Strengths-Based Research in Early Care and Education. The webinar will be presented by the researchers investigating sociocultural equity and race, also known as the RISER Network. Today's topic and the researchers themselves are at the heart of the Foundation's work. Our mission statement charges us to harness the power of research to ensure that all young children benefit from early learning experiences that affirm their individual, family, and community assets, fortify them against harmful consequences arising from poverty, racism, prejudice, and discrimination, and strengthen their developmental potential. But the Foundation's work also includes fostering scholarship, which we support primarily through our Young Scholars and our Promising Scholars programs. So we were delighted to continue to foster scholarship by providing the initial seed funding for the formation of the RISER Network. The Foundation is very proud of the passion and skill that these researchers bring to their work, and we thank them for their partnership. I will now turn the program over to the Foundation's Vice President, Sarah Vecchiati, who will formally introduce the RISER Network researchers. Sarah?
Thank you, Jacqueline. Many of our attendees joining us today may also be working to develop letters of intent to submit for our current 2022 YSP competition cycle. We hope this webinar helps YSP applicants, as well as all of our webinar attendees, to utilize a strength-based approach in their research designs as a way to advance equity in early care and education. Every individual, family, and community has their own set of assets that should be considered within all aspects of research design. Such an approach celebrates the racial, ethnic, cultural, and linguistic diversity of young children, their families, and communities. This approach seeks to understand how policies and systems might inadvertently or intentionally function as contributors to disparities, and it also focuses on how to improve systems and policies within which marginalized and underrepresented communities must function. With such discussion today, the Foundation seeks to transform the research narrative about the developmental trajectory of a diverse group of young children and early care and educational professionals, particularly those of color who educate and care for them. I have the honor of introducing the researchers from the RISER Network who will lead the discussion today on ways to incorporate strength-based approach throughout all research stages. The RISER Network is a collaboration of scholars who are working together to conduct applied child developmental research focused on the positive development of Black children. And in their own words, it is also committed to unpacking how racism is an environmental context that erodes health and educational disparities for young children. I'm delighted to introduce first Dr. Stephanie Curenton, who is a tenured associate professor at Boston University, Wheelock College of Education and Human Development, and she is the director of the Center for the Ecology of Early Child Development, also known as SEED. Next is Dr. Marisha Humphreys, an associate professor at the University of Illinois, Chicago, and a licensed clinical psychologist who engages in developmental and prevention science research. Also joining is Dr. Nneka Ibekwe Okafor, a postdoctoral associate also at the Wheelock College of Education and Human Development, and she is also a graduate teaching fellow at Harvard University. Joining today is also Dr. Jacqueline Sims, who is a research scientist, also at the Center on Ecology and Early Childhood Development at Wheelock College. Unfortunately, Dr. Ioma Aruka will not be able to join us today, but she was pivotal in the development of the resources shared today. And Dr. Ioma Aruka is a research professor in the Department of Public Policy at the University of North Carolina at Chapel Hill. Thank you all for sharing your time and expertise today. We look forward to hearing your insights. So now I'm going to pass it along to you, Nneka.
Thank you, Jacqueline and Sarah, for those introductions. We are excited to be here today to provide some guidance around ways to conduct strength-based research in early care and education in efforts to advance equity. As a reminder, attendees are participating in listen-only mode, so if you have any questions, please enter them into the Q&A box. We are recording this webinar and will make that available at the end. Any resources shared during the presentation will also be shared in a follow-up email. If at any time you have any logistical issues, FCD staff will be on hand to help and assist you. I will start by providing some background about the RISER network. We are a network of scholars committed to unpacking how racism is an environmental context that impedes health and education opportunities. We conduct applied child development research focused on the positive development of Black children prenatal to age 8, with the goal of disseminating our research to policymakers in order to dismantle education and health disparities. The network was co-founded by Dr. Curitin and Dr. Yaruka and supported by the generous funding from the Foundation for Child Development, who seeded the network in 2019. Now, through funding received from the Robert Wood Johnson Foundation, we are growing our network to meet our goal of developing a multi-generational network of scholars. Today, we are going to walk you through the steps of designing a research project from start to finish by delving deep into some of the guiding principles that match our values and philosophies as a network. We will demonstrate how we incorporate a strength-based research lens in efforts to promote equity within the early care and education field. We will first present and provide examples about how we might incorporate a strength-based approach when thinking about how we frame our research through the literature we use, how we develop our research questions. Next, we will then talk about strategies for identifying your methods and measures, and end by discussing ways to analyze your data and interpret your findings. Again, if at any point you have any questions during different sections of the presentation, please enter them into the chat, and I will do my best to answer a few directly, and will also make sure to read them at the end of the presentation. And with that, I will hand it over to Dr. Curitin.
Hello, everyone. I'm so pleased to be here today, and I'm also pleased because I think that I get the best part of the presentation, which is talking to you about developing your ideas. So of course, you know that all great science starts with a great idea. So I will be talking with you over the next few slides about research questions and literature reviews. So the research questions. Again, like I said, it all starts with a good question. And so what makes a question good to you as a scientist could be that it's something interesting to you. It could be based off of something that you observed. It could be based off a question that you see is sort of a gap in the literature. There are lots of different ways to sort of define what is a good question, but what's important is that when you start off on your study and your project, you have to feel committed to that question. You have to feel as though it's a good question and that it's interesting to you. One of the things that I like to do when I start too with my questions is really think about how do I frame my research questions. And one of the ways that I think constantly about how to reframe my question is how would answering that question really enhance children's lives? Right? So how is this going to make a difference in the daily lives or the long-term lives of children and families? The other thing, when you're thinking about your question, you want to think critically about, does this question reflect the strengths as well as the challenges of your study population? Or is the question simply comparative? And so what I mean by that is that what we know about our scientific literature in developmental psychology, in education, in child development, etc., is that we know that some of that literature is not, or especially when it's about children of color, that literature is not grounded in a strengths-based perspective. Based upon the literature that we're reading, it basically guides our thinking to sort of a certain way, which will inadvertently put us in a situation where we might be posing questions that are not necessarily strengths-based. And So I challenge you to think about, as you're reflecting on your questions, ask yourself, does this question really reflect the strengths that I know to be true in the study population, as well as some of the challenges that this study population is facing? And in terms of it being comparative, I think I'm going to come back to that on the next slide. But what I mean here is that it is not necessary to always have a comparative sample. It is not always necessary to pose a question in which your question, your science, your methodology is set up so that you are comparing your study group to what you consider to be sort of a neutral group, which tends to be, based upon our developmental literature, a sort of middle class white standard. I also want you to think about how your question is operationalized and how it's operationalized quantitatively or qualitatively. It's really important to make sure that the question you're posing actually can be answered in a meaningful way, and that it can be answered in a way that, again, like I said, can help us understand how the answer to this question is going to enhance children's lives, right? You also want to think about what background literature you were using to for the basis of your research question. And I will definitely come back to that on the next slide. And lastly, as one of the values that we put forth at Riser is that we want you to think about whether or not your questions are grounded in the understanding of structural and institutional issues, and whether or not they truly understand sort of the contextualized experiences that, that children and families are facing. Right. And so when we talk about sort of the literature review, this gets at the point that I was making earlier in terms of what is the basic, what is the scientific basis for your question? And it goes back to originally what I said in terms of how we know that our body of knowledge is biased. And it's biased just in the simple fact that most of our theories, right, were developed by white men. And that's a clear reflection of bias, because we know that there are other scholars of color who have been creating theories and doing work for decades. It's just that their theories, right, and their ideas are not given the same status as the theories from the white male scholars. So the challenge that I pose to you when you're thinking about your literature review is really asking yourself, what is the theoretical basis for this idea? And if you find yourself in a situation where your theoretical basis for your idea and your research question is only grounded in the science of white scholars, then you have a problem. Right? And what I would suggest to you that you do in order to help solve that problem is to search for research from BIPOC scholars with expertise in your study population. And these are some of the wide array of scholars that have been very influential to us in terms of early childhood education as well as elementary education. They're scholars that talk about culturally responsive practices. They're scholars that specifically have expertise in the study populations of racially marginalized children, and their body of work is very, very rich. And I just urge you to not only read it, but to also cite their research, especially when you find yourself asking questions about BIPOC children, families, and the education workforce. Again, the other point I want to make on this slide is to be sure to read the literature with a critical eye about whether or not it's deficit-based or strengths-based. And this goes back to what we mentioned before of how our science is biased. And Jacqueline Sims is going to talk with you about that on the next few slides. And lastly, I'm going to come back to that point again around contextualization and making sure that your study phenomenon is grounded in the contextualized life experiences of your study population, such as racism, discrimination, employment discrimination, such as issues about pay, etc. So whenever you do science, you want to make sure that you're looking at sort of those larger aspects and larger environmental aspects that really might be influencing the phenomenon that you're interested in studying. And I am going to end my few slides just reiterating this idea of framing again. Understand, as you embark upon your study, understand your own biases that might be shaping your questions and that might also be shaping the literature that you're seeking, right? And do this in a way that is humbling, with the understanding of knowing that that the act of research in and of itself, the way we're taught, is that it's biased, because it's coming from a certain framework, and a certain framework, that white male theoretical framework that has excluded scholars of color. So you have to, as a scholar, be humble enough to understand that as we embark upon these studies, we're coming in with a bias. And so in order to guard against that, we have to actively be thinking and doing things that, that go against that natural bias. Again, I come back to the question of, how is your question enhancing children's lives? How is it enhancing the lives of the people who are educating and caring for children? I like to call this sort of the price of rice question. So it's the idea of, like, what does this question have to do with the price of rice, as my grandmother would say? Like, how is this going to make a real impact in the daily lives of families? You also want to think about your framing, the potential solutions. So once you know your answer and you start to think about, what are the solutions? What would I suggest to be solutions for this question that I've solved? Think about the solution critically and say, is it a top-down solution or is it the reverse? Does this solution ever ask communities and families and the workforce what is needed to enact the solution? Or does it prescribe what is needed to meet certain standards? Or does it prescribe what the solution is based upon this prior knowledge that, as I said, we know is biased? And does the solution ignore context and history, specifically as it relates to racism and discrimination and xenophobia? And then lastly, when we think about framing, once you know the answer, thinking about the messaging, right? So is the message of your question, your research question, does it maintain the pejorative narrative and the oppression of a particular group of people? And what I always like to say at Riser is that we're really focused on conducting research that supports sort of the counter narrative. We're looking for those examples and trying to highlight those examples in our research studies and in our literature base that actually show BIPOC children, families, and educators from a strengths-based perspective.
All right, thank you so much, Dr. Carrington. I think that that's the really nice transition into thinking about a deficit or a strengths perspective in your research. And we know actually that a lot of the research and practice interventions focused on the EC workforce often do take a deficit perspective, which really reflects a pseudoscience based on beliefs, whether they're implicit or explicit, of inferiority due to race, social class, gender, and other forms of social stratification. So deficit perspectives, as you can see here on the left, are really problem focused. They're explicitly looking to solve a problem in a community, often with this underlying question of what is missing that we must go find. And in terms of context, these deficit perspectives really situate the causes of outcomes in the individual and not in the context. On the other hand, a strengths-based perspective, which Dr. Carrington was just mentioning, really situates causation in the interaction of the individual and societal factors, so the opportunity structures or poverty or segregation. So this strengths-based approach can still acknowledge the social stratification, but it focuses on the interaction between the individual and these factors. So by doing that, our research can really focus on the capacities, the talents, the assets, and the agency of the individuals in the context of these factors. So instead of that question of what is missing that we must go find, a strengths-based perspective is really going to ask what's present already that can be leveraged and built on. So key concepts in this perspective are really going to be adaptation, resilience, voice, and contextual and situational influences on the individual. So that's where you might see the effects of racism or patriarchy. So let's say that you're interested as you're developing your research questions, in communication and collaboration between ECE professionals and the families that they serve. A deficit-based perspective may seek to simply document different rates of common outreach techniques that ECE professionals are engaging in. You might see low rates of outreach on some measures, and a deficit approach might find fault in the individual's practices rather than considering the context that shaped them. So things like the structure of the education system and what's valued or emphasized in credentialing requirements. On the flip side, a strengths-based perspective may start with the question of what's working. And it may work to identify what ECE professionals are doing in their community and what they feel confident about. And then asking this question may then inform understanding of challenges that they're experiencing with other outreach efforts. But by having the information about what's working well, it can really help us understand whether the ones that are causing challenges are even appropriate or applicable for the community. So with that, that was kind of thinking about how you develop your research question. As Dr. Carrington said, that's the really exciting stuff, the big brainstorming. And now we're going to get into some of the nitty-gritty in terms of actually answering your question. So thinking about the sampling, thinking about the measures that you'll use, and thinking about when it comes down to it, how you'll actually analyze your findings. So first, there are some important, guiding principles to keep in mind before even beginning to identify your sample. So you may have an idea of your question and the workforce or the children that you're interested in studying, but before even picking up the phone or writing an email, it's important to acknowledge your positionality, right? And this is important in a few ways. So one of which, it's just important to acknowledge our positionality as researchers. So when we're thinking about equity in research, we have immense privilege as researchers, and we need to keep in mind the ways that research has been and continues to be weaponized to maintain different systems like racism. So there's a lot of literature out there you can read, a lot of scholars that you can turn to if you're interested in learning more about this and making sure that you have an understanding of your positionality as a researcher. It's also important to acknowledge our positionality in other forms of our identities, such as our race or our gender, and understand how our identities shape our interactions with our samples and also our perceptions throughout the research project. Before, figuring out your sample, it's also really important to keep in mind that that doesn't happen overnight, right? It's important to put in the work to build relationships with organizations, community leaders, community members who are going to be attuned to the strengths and the needs of the community that you're working in, and we're going to be able to offer their perspective on your research. So this could be, the EC professionals themselves, supervisors, it could be families in the schools you're hoping to work in, it could be community organizations that also work with the populations in that school. So maybe they provide professional development or training. And these relationships, as we'll talk more about later, I think at the end of the presentation, this isn't a one-sided relationship, right? You can work with these partners as you build these relationships to identify ways you can support them and their work just as they're supporting you and your research. And building these relationships is also going to be really important in helping to make sure that your research will actually leverage the strengths of the community and address the needs in order to shape interventions that your research may inform. Lastly, these relationships are also going to be really important when you put in the work to maintain a longitudinal sample, for example, and when you scope out what equitable pay is going to be for people participating in your study. So these community members and leaders, have the knowledge and the experience in the background to provide insights into what equitable pay may look like for people who are sharing their time and their perspectives with you for your study. And that is both in terms of amount and also the format of payment. So in terms of actually identifying your sample, it's important that you make sure that your sample and your questions about that sample, as Dr. Carrington mentioned, are really based on the literature about that sample, not approximations of that sample. So if you're interested in the workforce and publicly funded ECE, for example, you can still draw on literature outside of the publicly funded space, but you'll need to make clear theoretical links for why that literature is important and how that's informing your hypotheses about the sample that you'll be working with in the publicly funded space, for example. It's also important to loop back to the community experts that you've built relationships with to figure out who would be the right participants to answer the questions that you're interested in exploring. And Dr. Carrington touched on this, and we'll talk more about it later, but even just at like the sampling stage of your research, it's really important to think really critically about any comparisons that could be made within your sample. So even if you don't explicitly intend for these comparisons to be made, it's important to be thinking in advance about how you can situate and provide any context for differences you may see across ECE professionals from different social stratifications and backgrounds. And lastly, before I hand it over to Dr. Humphreys, I'll just say that it's, ideally you want to ensure that your sample is not confounded by race and income. However, in reality, we know that in the ECE workforce, there's going to likely be this confound among low-paid racial and ethnic minority women that you may be working with. So given that this confound exists, it's really important to generalize your findings specifically to the sample that your study is drawn from. So make it very clear in terms of as much background information about your sample that you can provide, that is who your findings are generalized to. We also want to ensure that the sample is representative of the communities being studied. So for example, if you're interested in understanding immigration-based stressors on the ECE workforce, working with immigrant families, you want to have an understanding of where the families in the community are from, and then make sure you work with ECE providers who work with those diverse families and generalize those findings just to this community. You can make hypotheses and connections for future research with other groups, but make sure that you're staying true to who it is that you're studying and who it is that you're working with. And lastly, it's important to ensure that pan-ethnic and racial groups that you work with actually reflect the heterogeneity of those communities. So for example, Reiser's research is really grounded in this idea that Black children thrive in diverse communities. Those communities are distinct in nationality, nativity, ethnicity, and linguistic traditions. The same is true of Black educators. So if, for example, if you're interested in understanding racial mismatches or matches between an educator and children in the ECE context, make sure that you're attending to the heterogeneity within those pan-ethnic and racial groups. If you can't match an educator and child with that level of specificity, then just be sure to discuss that and provide context for those findings and attend to the heterogeneity within these groups that's often ignored in research. And with that, I will hand it over to Dr. Humphrey.
Thank you, Dr. Sims. So we've talked about kind of your questions and developing your sample, and the measures obviously go along with both of those. And so the thing to really think about as you're developing or picking the measures you want to use rather for your study is to make sure they accurately and truthfully capture your data of interest. And I think this is the piece where we often see problems, is that we're not researchers, because of the way in which we're trained, as Dr. Carrington spoke of, we kind of take the items that are out there, the measures that are out there that are quote unquote the gold standard. And those gold standards may not be so for various populations. They often aren't. And so the data that you get from those may not be accurate, and they might not truthfully capture their experience. And when we use inappropriate measures, that can lead to biased findings. And we make these assessments and we make these generalizations about a population, and they're based on inaccurate findings from our measurement. And so that just contributes to the deficit framing that's been talked about so far. And so when we're thinking about measures, it's not just about, okay, well, what's been used to capture stress in ECE teachers, right? But it's really about, how do we measure stress among ECE teachers from different populations, from different cultural groups, racial groups, ethnic groups? And so we can't be what I call race mute or race blind, colorblind when choosing measures. We have to interrogate race when we're identifying measures to use, and also interrogate race when we're thinking about what we want to measure and how we want to measure it. We've been trained so much, I think, from our disciplines to as this kind of objective space, right? But race is a contextual factor. And as been noted several times by Dr. Carrington and Dr. Sims, racism is an environmental context that impacts development. It impacts the adults that work with young children, and it impacts young children and their families. So we can't be blind to it. We have to think about it even in our choice of measurement. And so we want to make sure, and what we put forth with Riser and what we are advocating is that when you pick measures, they should provide equitable data for BIPOC participants. And again, I think it was already noted in the chat that BIPOC stands for Black, Indigenous, and People of Color. And so we want to make sure that when those participants are in our study, the data that we're getting is equitable, that we don't lead to a bias misrepresentation. And so you have to ask yourself, does the measures that you've chosen for your study, does it allow BIPOC participants and all participants, but especially BIPOC participants, does it allow their strengths to be highlighted? And that's a real question that you really need to sit with and think about. And if the answer is no, we're suggesting you need to reassess your measurement choice, because you want to make sure your measurement is providing a full and rich picture of your participants. So yes, you may still be assessing things where there's a space for improvement or help, or where your population is struggling, but you also want to be measuring strengths, because those go together. You don't have a full understanding, right? And to do that, you have to choose measures that are reliable and valid for your population, which means you have to think about issues of cultural relevancy. Again, going back to the point from the previous slide, the gold standard, we contend, is not going to be reliable and valid for your population if it's not culturally relevant, because you are often measuring something that does not match how your population may think about or experience your construct of interest. So it may seem easy for us to sit here and say these things, but you might be thinking, okay, so what am I going to do? I'm trying to develop a study. I want to measure these various constructs, and I don't know what to do. If I don't find something when I'm looking at my measures and I'm looking at the population they were normed on and the retest reliability studies, and I'm looking at the sample and the diversity or lack thereof, and I just can't seem to find anything that gets at my construct of interest. So there's a couple of things to do that we suggest. One is you then need to consider using multiple forms of measurement for your construct of interest. Instead of just having one measure of stress or one measure of attention deficit hyperactivity symptoms, you need to have multiple measures so that you can engage in something that's often done, for instance, in qualitative research, which is triangulation. You're getting measurement of your topic of interest across different spaces from maybe different informants and in different ways, so that you can look across those different forms of measurements to be able to more reliably and validly say that you've captured your construct of interest. And we'll talk a little bit more about methodology on the next slide. The next thing to do, and Dr. Sims mentioned this, is you need to engage with the target population. Far too often researchers come in and quote unquote research participants. There is no engagement with participants. There is no way for them to share and expand and to tell you about the issues that are relevant to them. And you need to remember, they are the experts on their experience. They are the experts on their lives, not you. We're experts in how to do research, but they're experts in their lives. So having focus groups, interviews, or just various ways that your population of interest can, one, share with you, do they even conceptualize the variable of interest or construct of interest that you've identified the same way? They may not, which means you need to retool what you're doing, because then you're, again, measuring something in a non-valid way. So how do they conceptualize it? How do they define it? What suggestions do they have about how to measure it? You'd be surprised. They have lots of strategies. So I'll give an example in a study that I was a part of, it was really about looking at parental monitoring, and later leading up to, it was a longitudinal study, engaging in HIV prevention. And so the researchers were saying, well, this is what we know from the research. We have to talk about sexual behavior, and the families, because they decided to have a board made up of researchers, family members, and community members of their population of interest, said, that's not going to work. That's not how we engage. Actually, what you need to do is ask these types of questions about monitoring and what they're doing, and types of things around just healthy development, right? And so they worked together to come up with a form of measurement that allowed them to capture behaviors of the young people that actually more aligned with the population of interest. And it actually allowed them then to develop a much more valid intervention, or rather prevention program later, that really aligned to their interests. So making sure you actually engage with your population of interest. And I'll just say, and not after you've already developed your study. Don't come in at the end and then ask people to come in and approve what you've come up with. You want them at the table early and at the beginning, because you want to honor their expertise. And let's say that, okay, but you're doing a study and you have to include the Connors 3 in your study, because you're doing ADHD research and people want that there. And yes, you may come up with other pieces, but that you have to include it. Then you want to be able to speak to the limitations of that measure, right? If it has not been validated on your population, if we don't have reliability statistics. So you have to temper the meaning of your findings when you get to discussion. You can't make these broad generalizations. You have to be able to speak to really what that measure actually measured, specifically for your population. And so be really kind of surgical in how you're writing up the findings. And then as we're thinking about measurement, again, you want to make sure it's appropriate. And so we can think about mixed methods. And I kind of spoke to this a little bit in the previous slide, is using both qualitative and quantitative mixed methods design, and your qualitative design allowing to get information around observations and interviews and focus groups and narratives. Now, that doesn't mean that using a qualitative form of methodology can't lead to bias, because it definitely can, because if you have observers that haven't been adequately trained to understand their population of interest or have experience with the population of interest outside of a negative connotation, you're still going to have bias findings. So that still requires work, but it allows for, in addition to pairing that often with quantitative, and in terms of quantitative measures that may not have been validated with your particular population of interest. And so an example from another research study that we did was looking at children's social and emotional competence. And if we had gone the traditional route, which was to have teachers fill out a measure and to have parents fill out a measure of children's emotional and social competence abilities, we would have really missed a lot of information, because the teachers were not reporting on Black children's emotional competence behaviors in the ways in which we had blind observers reporting back. So we had blind observers in the classroom measuring children's social and emotional competence abilities. And when we looked at their data in comparison to the teacher data, it didn't align. Our blind observers were rating the children as having high levels of positive emotional competence abilities, and the teachers were not noting that. And so think about what would have happened if we would have only went the teacher report. We would have continued to contribute to this idea around a deficit orientation for Black children. But because we have both, we were really able to say, Black children are actually exhibiting these positive behaviors. Let's think about why teachers aren't capturing them. Let's think about how teachers are then assessing Black children's behavior. Right? We need to think about, how are we assessing Black children's behavior? How are we tapping into what teachers know, what teachers' perceptions are? And that can also lead to things like implications around programming and policy in terms of the work that may need to then be done with teachers who largely serve Black children. So it's really important to make sure we're utilizing measures that accurately capture children families and their teachers, but we're doing it in a way that also allows for the broad whole perspective of, in particular, BIPOC individuals, because, and I'll give one last example, just in the ways in which stress is measured. Stress is a very individualized perspective, and when we view stress measures with certain adult populations, we're actually not capturing their real stress based on what they're being asked. And the same is true for BIPOC children. So again, making sure we have these different forms, because we had a narrative perspective where they could write open-endedly, 3 or 5 stressors, we were able to identify, oh, stress looks different in this population, is processed differently. Had we not used this narrative to go along with the quote unquote traditional quantitative gold standard, we would have missed it. And so now we'll switch, now that we have our measurement, over to analysis.
Okay, great. So I am going to chime back in a little bit, and I'm going to start off this section about analysis, talking about something that I think we as a field need to think of more critically. This idea of how we in our models often try to control for the effects of real world contextualized variables, such as race or ethnicity, things that we cannot actually change. So for example, what I mean is that the statistical method of covariating actually came from the experimental literature when scientists were attempting to control for or hold constant an effect of one variable in a study, and in an experimental study. And this has now evolved into a process in which we as scientists are trying to covary things like race and gender, when in the real world, these contextualized variables can't actually be held constant, and they can't actually be manipulated in any meaningful way. And so I just raised the question for us is, why do we do that? Why do we do that? And what does it mean if we have results in which we're covariating things like race and ethnicity? How are we then supposed to interpret those results? Because we cannot hold constant something as something related to sort of like race or ethnicity, and even gender. And this is a quote that that I found that I think speaks to this idea well. And the quote says, race is not something we can intervene on, and the associated counterfactual queries generally strike researchers as meaningless. The question of what would a Black person's health outcome have been had they been white seems like a very strange counterfactual to pose, right? So you might be asking, well, what do I do? Because there are real instances in which you want to, you might want to understand how a phenomenon is affecting one population versus another, and and the general question too is, how do we treat sort of these real world contextualized variables? How do we treat those in our models and in our studies and our research? So what I'm going to tell you here comes from research knowledge, my own prior research knowledge, methodology, as well as a blog post that I found as I was preparing from this from the Urban Institute. And this is a blog post that came out in March, and the author was talking about combining racial groups and data analysis can mask, and it's called Combining Racial Groups and Data Analysis Can Mask Important Differences in Communities. And so I'll start with my first point of, if you have a diverse sample and you really want to understand whether or not the phenomena that you are studying sort of is operating across this, operating in the same way across these diverse groups, it's really important that you examine group differences within context and within meaningful ways. One of the ways to do this in our modeling is to use interactions, right? To use interactions as a way in your model building to see, is there something about sort of race and ethnicity or nativity status or anything that could be interacting with the other study variables in a meaningful way? Another thing that you could do is actually run separate models for the different groups. It's common for us to think about running like a structural equation modeling, maybe for teachers who are at Head Start, working in Head Start, versus teachers who are working in state pre-K, and sort of looking at these things in terms of understanding, does the model hold up across these two groups, right? Because things like that can really help us understand what the phenomena is, what the root causes of that phenomena might be. And it's also important to examine if the patterns of results are the same for all groups. And, you know, some of the things with this is just are very, very basic things that that we need to do, and that maybe some people have gotten out of the habit of doing, of looking at your correlation table by group differences, of looking at the group means across the differences, and really doing all of that descriptive work to understand, are these study variables operating in the same way across all of my various populations that are in my study? The other thing that you want to do in order to answer questions like this in general is to be sure that your study population is racially and ethnically diverse. And you want to oversample, in particular for smaller underrepresented groups. This is especially important for us when we look at our Asian American groups and our Asian Pacific Islander groups, and in particular our Native American groups. So all of our BIPOC populations that have smaller numbers in the larger population. In our studies, we want to oversample for those populations in order to really understand how the phenomena is acting in those populations. And lastly, this goes back to something that Dr. Sims and also Dr. Humphreys were alluding to, with this idea of weaving in the expertise of BIPOC scholars and their organizations and their communities when trying to interpret your results, but also around your model building and development, asking them how they think the phenomenon might be operating. That can inform the way in which you build your models. Okay. So we're going to go to our last section, which is about meaning making. And this really gets us to the point of thinking about how we interpret our findings and the dissemination of our findings. And I'm going to turn it back over to Dr. Humphreys for this part.
Great, thanks. Interpreting our findings, we need to be really careful. You need to be really careful in terms of generalizability statements in your discussion. So you finally, you've been thinking about these issues. You started with, conceptualizing, what you want to study, developing your research questions, making sure you have a good sample, good measures, that really are from an equitable standpoint, but then it all falls apart in the discussion when you have these very broad generalization statements about your findings. You want to make sure the discussion pieces you're putting there are relevant to the population that was in your study, right? These broad statements of, oh, African-American children, blah, blah, blah. That's not true. You didn't study all African-American children. You didn't even study a nationally representative sample of African-American children or Mexican-American children. You studied 300. So you want to make sure you're talking about your findings in relation to the population of interest. You want to make sure you're not just saying, white teachers in early childhood settings. You want to make sure that you're talking about who was in your study. So if they were white teachers from a suburban community that served a largely working class population of children who were majority Latinx, then you want to make sure the statements you're making in your discussion link to that and not make broad generalizations, because by doing those broad generalizations, we actually, again, contribute to the deficit orientation. And the other piece is when you're thinking about your findings and the meaning of your findings and reporting on them, you need to assess your own biases. What are you bringing to the table as you're writing? How do you think about this population? How do you think about these early childhood teachers? How do you think about families? How do you think about the families of the children in your study? How do you think about the children in your study in terms of their racial background, socioeconomic, culture, in terms of geography, and think about if that lens, are you using that lens to interpret your findings? Because if you do, then your biases are coloring what you have. And so there, a lot of reflection needs to take place. And I think this is a space that doesn't often happen with our work. We talk about it in terms of working with the adults that work with children and young children. Oh, you need to be reflective. But as researchers, we need to be reflective. We need to think about what type of biases do I have? How do I think about, for instance, teaching? How do I think teaching should look? What do I think it should look like? And how is that impacting how I'm looking at this work? So you can start kind of challenging your own biases or potential biases, attitudes, and beliefs, and seeing how that impacts how you're thinking about these findings. I think having a research team that has a diverse group of individuals in terms of perspectives and experience can also help identify for you if bias is leaking into your work. And then the next piece is dissemination. Most of us are doing this work because we really care about and we value the experience of young people, of young children, and we want them to have positive context that allows for their positive growth and development. And so, you know, beginning to think about how can your study findings be used to inform policy, and there will be a little bit more talk about that from Dr. Cureton in a minute, but also thinking about how we implement programs, how we think about that work. And you can obviously speak to some of that in your discussion in terms of implications, but again, you want to be careful. Oftentimes I see very far-reaching statements by researchers about the implications of their work. You need to rein it back in and make sure that that it really aligns. The other piece about dissemination is thinking about how do you share this information with those that you worked with. So if you're in a Head Start school, going to Head Start classrooms, or you're going to early childhood centers, or you're going, even collecting data for pre-service early childhood teachers, are you going back and sharing your findings? Because there should be a feedback loop where you go back and share. You just don't go in and take, right? You need to give back. This is what we learned from the research. This is the valuable information you provided to us. Same thing with the families that are in your study, making sure you're sharing what you learn and getting feedback so they can actually say, yeah, that sounds about right. Or you know what, I think you actually got a little bit of that wrong. And this is what we think you got wrong. And you have to be open to be able to hear that so you can think about how you move forward. And so the other thing about dissemination is now that you've learned something maybe that's critical, how can you give back? So do you go back to the early childhood center and do workshops with teachers? Do you offer workshops with parents? Do you offer, that's another way to give back, to being able to disseminate. This is what we found, and this is what we appreciate that you share it with us, and this is what we want to give back to you, so that it isn't just in some digital space for another researcher to click on. So it's really important to, think about how can your work actually positively impact the lives of young children and the people that serve them, and really thinking about that, because I think we want to do it, but we don't think about how to do it. And so these are just some examples of ways that you could do that. And so I think Dr. Cureton is going to make the connection to policy here.
Right. So I'm going to end us coming back to this idea of framing and thinking specifically about how to frame your results for a policy message or for a policy audience in particular. As we mentioned earlier, one of the goals of RISER is to be able to communicate our research findings to policymakers so that they will have information to be able to use as they are designing or implementing policies and programs. So it is our strong belief that policy should be informed by applied research that is culturally grounded and that takes into consideration contexts like racism. So this is the heart of the work that we do, and this is the work that we think is very instrumental to the development of creating policies that are not deficit-based. And what we have to realize is that much of our policy making is often comes from a deficit perspective. Some of that has to do with the nature of policy making in general, not just specific to BIPOC populations, but the policy making process in general is problem focused, right? So as policymakers, they see it as though if there's not a problem, then there's nothing to solve, right? So coming from understanding and knowing that larger framework from the policy field, it's critically important. It's even more important that we are presenting ideas and research in a way that helps to counteract sort of this deficit perspective that is sort of at the very heart, of their field. So one of the ways that we do that is to make sure that as we are designing our research, that it's strengths-based, and that it's strengths-based with the ultimate goal of helping to solve these societal problems. And this is what's really important, is understanding that what is strengths-based is really about helping people understand the skills and the tenacity and the wisdom that is present in a lot of our BIPOC populations, and understanding that just taking the position as though I'm opposite of deficit, just saying that I don't want to have a deficit base, doesn't actually mean that you are then taking on a strengths-based perspective. To have a strengths-based perspective, you have to be explicit. It's the idea of when we tell young children, don't run, right? So children in the classroom might be running and the teacher says, don't run. But what is happening then is that if the teacher does not then talk about sort of what to do instead, then the children don't know. They're left wondering. So in some way, when you think about that metaphor, policymakers are the same way. So we want to make sure that our research isn't just, that it can't just be used to tell them what not to do, but it can also be used to help them generate ideas about what to do to solve problems, and to be able to solve these problems, not only thinking about the challenges that our society is facing, but also thinking about, like I said, that tenacity and that strength and the positive resources that are available in these communities. One classic example that we have in terms of the situation of how research has gone wrong in terms of the policy world is the Moynihan report. It was specifically called The Negro Family, the Case for National Action. So this report was the first, it became sort of, it is one of the most controversial government documents of the 20th century. And the research, right, that was presented in this report painted the picture of African-American families and communities as being dysfunctional, right? And dysfunctional across a myriad of ways. Given that, as such, what happened is that policymakers took the knowledge from this report, and what they did was that they started to create policies. They used this information to generate ideas for the policies that they could be creating to sort of fix this population that they thought was problematic. And you can only guess that the policies that they generated were policies that were not maximizing the strengths and the innovation that existed within those communities. Instead, the policies were actually related to sort of control. The policies were actually created in a way that made the population actually more dependent, on the government in a lot of different ways. And so that is just a classic example of how science done wrong can be detrimental, and it can be detrimental for the long term, because we are still living under the policies that were initially created from the Moynihan report decades ago, right? I think that's my thing. So I think that's my point that I want to bring forward as sort of a classic example of what not to do. And yes, I think that's it. I think that's our last point for that one. I think that was our last point for that one. So at this moment, what we're going to do is open up the session for questions. And we will have NECA, who will be fielding the questions. And if you would like to share a question, please put it in the question box. Do not put it in the chat. And we will go around sort of as a team and just sort of answer as many questions as we can. So we'll open the floor to questions.
Yeah, so there are a lot of great questions in the Q&A, so I will do my best to track them all. The first one, I will field this to Dr. Curenton and Dr. Humphreys. Can you provide examples of strength-based questions versus comparative questions?
So I'll go first. So a comparative question is simply a question in which you are comparing sort of how the performance of, say, one group to another, or you're comparing the phenomenon, how it exists in one population versus another. So it could be an example of teacher stress, and this idea of looking at the question in terms of, are Head Start teachers more stressed than school-based pre-K teachers? That is a comparative question. You're setting up your question in a way that the answer has to be a comparison between groups.
Yeah, and then as opposed to if it's a non-comparative question, if you were interested in stress, could be, how do Head Start teachers perceive stress, or how do they conceptualize stress? You're not comparing them to others. The same is true when you see things, a question is, how are, Mexican American and European American children differ in terms of their reading achievement scores. And so you're not trying to understand each of those groups independent of themselves, understand but you're doing this framing of comparing one to the other. And typically what happens oftentimes is that we don't look at that as just, if there's a difference, the difference as a difference. We conceptualize the difference as a deficit. And so we're putting one up as the yardstick of which everybody else is measured up to. And if you don't reach that, then there must be something wrong with that group. So that's a kind of a comparative perspective.
And I would just add on to that too, maybe a more interesting question, if we're talking about our fictional question that we're posing here, is sort of a question of, does the phenomenon of stress operate in the same way among teachers across different educational settings? Now, the reason why I would argue that is different, it's different from the first example, is because what you're doing is that you're using your data, you're collecting data, and you're going to then look at each group within itself. It's going back to that slide where I talked about sort of examining group differences and sort of looking at sort of modeling sort of each group in a unique way, because what you're trying to understand is the phenomena, the development of the trajectory of the phenomena, and in the hopes that you'll be able to gain knowledge of how to reduce that stress.
Great, and then so the next two questions, I'll combine this, and I'll start with you, Dr. Sims. So an attendee asked, when we conduct literature searches, we just look at the names without knowing their BIPOC status. I wonder if there's a repository of BIPOC scholars' work so that we can intentionally look for them. And then connected to that, wondering if the Riser Network has any recommended scholars or theories to use.
Yeah, that's a good question. Maybe that's something that Riser needs to do. We don't currently have like an official recommended list, but I do think that, starting with theory, like starting with some of those theorists that Dr. Curenton showed, like instead of going to the few that everyone always thinks about in early child development, instead bringing in Asa Hilliard and Joyce Keane and Janice Hill and Geneva Gay, that's a good place to start. And I think it will kind of snowball out from there as you start to cite more and more those are all Black scholars, but more and more BIPOC scholars in general. We don't currently have a repository. I don't know, Dr. Carrington or Dr. Humphreys, do you have anything else to weigh in on that? Wait, I have one other thing. I'm sorry. I was just realizing this is what I was thinking of. It is, sorry, Dr. Carrington. I will say that I think that there's an increase in attention to this issue. So I think you'll start to see more and more discussion of this. So American Psychologists, for example, just put out a call for a special issue on foundational contributions of Black scholars in psychology. So I think that keeping an eye out for special issues like that, looking at specific journals that focus on African American families, for example, and looking outside of just, some of the quote unquote top journals that people think of, really broadening to bring in different journals that might feature other authors.
Yeah, the only thing that I would add to that is what you said about the journals, because it seemed one of the parts of this question is sort of how would we find these sort of scholars of color? Like, how would we know, right? So one of the things is, I showed you a slide of different scholars. We mentioned some of them by name. You can start to Google those scholars and find out their work. Another strategy that Dr. Sims was just mentioning was this idea of sort of specifically looking for research in journals that are dedicated to publishing work about your populations of interest, and as well as journals that are interested in publishing work around sort of racially and ethnically diverse groups in general. So what that will do is that can lead you to some of the work that is really grounded in sort of the theories that people are posing for these different populations, and it will also give you at least a short list in terms of scholars of color, right?
Yeah, so I would just agree with what's been mentioned by Dr. Carrington, Dr. Sims. It really is about now getting out and educating. I've put some things in the chat, and I'll try and put some more in terms of potential resources. So you have some potential names already, looking at particular journals. And going and identifying that there are, journals that are targeting certain populations, whether that's, Journal of Black Psychology or Hispanic Journal or Culture and Minority Psychology, and the APA has journals. So they're out there, and it's really about kind of stepping back and thinking about the work, and using, like we always do, using the names that you got today, using our names even, and looking in our reference section and seeing who is doing this type of work.
And so the next question is something that we're often thinking about. In thinking about characteristics of populations for study, how best to tease out race and poverty as confounding variables? And Dr. Sims, I'll hand that over to you first.
Who did you say? Okay.
You're welcome to jump in, Dr. Carrington. I would say, I think, I believe Dr. Carrington mentioned this, but I think it's attending to it, right? So I think the first step to do is to take a look, and like Dr. Humphreys mentioned at some point, don't make a statement about African-American children. Really dig deeper to figure out what African-American children were in your sample, or what ECE providers were in your sample. So I think that that's the most important thing, just to first know to tease it apart. And then I think, if possible, trying to oversample and trying to make a concerted effort to pull in, upper and middle income Black families, for example, or pull in, if you're looking at just across, to be able to pull in and oversample for underrepresented groups, I think is really important. I think too often a lot of ECE research focuses on, low income populations, and then makes generalized statements out to racial and ethnic groups based on that. I think other than that, and I'll let Dr. Carrington and Dr. Humphreys weigh in, I think other than that, being able to just provide context when discussing the findings is really, really important. If you're not able to tease it apart empirically, then to just be able to provide really thoughtful discussion of those findings, I would say.
What I would add to that question is to take 2 steps back. So if you're at the point of analysis and you're saying, oh, how do I tease apart this confound between poverty and race? What I pose to you is take 2 steps back and go back to sampling, right? Because you have this problem now at the analysis stage because you allowed your sample to be one in which you did not strategically sample the diverse economic SES groups of your BIPOC populations. And so if you want to sort of prevent that problem from happening at the analysis stage, you have to be very intentional in your sampling. And we used to do this, this is way back in the day when I was a graduate student in developmental psychology. And this whole idea of when you're creating your sample, if you wanted a sample of middle class, say Black families, you had to strategically target places in which you thought middle class families were operating, were engaging in their daily lives. The flip side of that too is with my sampling for a little study that I did in Head Start for Head Start children with preschoolers, and I actually needed more low-income white children in Charlottesville, in the Charlottesville area. What I had to do as a scholar in graduate school to find those children, I was driving throughout all the rural areas in Charlottesville, Virginia, to test children that were low income, rural and white children. So that I would not end up at the analysis phase having to sort of try to tease apart this compound. So I just say it's something that you can deal with in the initial phase when you think about your sampling.
Yeah, I won't add too much. Oh, sorry to that, but it really is thinking about that beforehand, because if you only have one socioeconomic group represented for your racial group, then you need to then you're already kind of past the point that Dr. Carrington talked about, like you think about at the beginning, and just think about what you have and be able to speak to that, but that you have an interaction here of race and class. And so you can't make broad generalizations about one or the other separate, that what you can make is, this is what we know about Asian Americans who are working class who participate in this study. I think the other piece to think about is that far too often, and Dr. Carrington gave a good example when she was talking about recruiting, is we only go after one particular socioeconomic group for a particular racial group. So if we're talking about BIPOC children, majority of the time they're always from low income or poverty. And if we're talking about, white children, by far they're typically middle income. And so then we have this void, and Dr. Carrington gave the example of trying to find, more low income working class white families. They exist, but we're so, the research is so used to doing that. So you really have to think about, what are you really presenting on, or what are you really trying to study? Are you trying to study the effects of socioeconomic status? Are you trying to study the effects or looking at issues of race or ethnicity, or the interaction of the two, and being able to be clear in your writing about what that means in terms of if you do have that intersection.
Great. And then there's another question, a great question around reflecting on positionality and researcher biases. I will drop something in the chat. There's a great article around race, culture, and researcher positionality. So I will drop that in the chat, and we can also share it in the follow-up email. Dr. Carrington, there's another question that I think it's perfect for you to talk about access. So how are RISER and FCD trying to advance strengths-based, culturally relevant measurement when such measures do not really exist?
Yeah, I think that this is a good place to talk about the access tool. The access tool is a classroom observation measure that really looks at classroom quality with the racial equity lens. It particularly looks at the experiences of racially marginalized children in that classroom. And it's designed such that if the racially marginalized children within the classroom are not having a high quality experience, then there's no way that then the quality score for that classroom can come out being strong, right? Being high, right? Whereas when we look at some of our other measures, our traditional, we have a long history in early childhood of having a lot of different classroom measures. And what we know from those different measures is that it is quite possible for a classroom to have a high quality score on a measure and not and still and be and I should say this way, it's quite possible for a classroom to have a high quality score without directing high quality interactions specifically to the BIPOC children in that space, right? And so that is a flaw, and it is a sort of bias that has grown out of the literature base that we have around what we view as quality. What the access measure tries to do is that it sort of opens up that notion of what quality is, because it comes from the standpoint of unless there's racial equity in that classroom that is happening, then it cannot be high quality, right? And so it is a tool that was, the development of that tool was seeded again by the Foundation for Child Development. It was also seeded by other foundations like the Brady Education Foundation, et cetera. And we're continuing to develop it and really get the tool sort of out there for programs to start to use and for researchers to start to use. And it's not just about sort of having this tool, you know, that is going to give us certain scores. I think the other thing that's really important about the ability to be able to create such a tool is that it shifts our framework. It shifts our mindset into how we conceptualize what is quality. And so that's just one example. There are others, but I was just going to talk about access there.
And so for the next question, Dr. Humphreys, can you speak to how we might incorporate community members from the beginning of our research project?
Yeah, I think that's a good question. Well, one, think, you know, at the very beginning when you're thinking about what you might want to do for your research, and you have started thinking about, you know, the participants, what relationship do you have with those participants, and being able to go out and make those connections. So that means going into the community. Where do your participants live? What type of community organizations are present? Whether they're schools or early childhood centers, Boys and Girls Club, how can you go out into the community to, one, begin to get to know them? And then as you go out into the community and learn who's in the community, you'll also, you know, begin asking and finding out kind of who are the leaders, who, and I don't mean leaders like people you see on TV, but leaders in the sense of everybody in the community knows X person, right? Everyone knows about this person or these people. Those are the individuals you want to connect with and get to know and share. This is what I'm interested in. What do you think? And begin to have real conversations. And so you haven't developed the full study yet. You just have a general idea about what you want to study. And then you make those connections going out to the community. You can create an advisory board that includes, you know, members of yourself, your members of your research team. It can and should include members from the community. So it could be those quote unquote people that we've identified as leaders, a few family, parents or caregivers that represent the age group you want to work with, a few individuals that work with families, whether those are teachers or center leaders, and have that board, and then you work together to come up with a shared way of working. How will we decide what we're going to do? You know, what's the policy? So a project we worked on, we had an advisory board. Another project I worked on, and nothing could go out, not a paper, a manuscript, not a grant, not a use of a new measurement tool, without that advisory board reviewing and having a vote and approving. Yes, it does add to the length of time, but I can definitely say not only that I learned a lot, but I felt like the research from that was much better because it truly reflected the population, and it really, it wasn't an afterthought. So I would say you have to get out to the community and get to know the population that you want to work with. And so that requires you to make yourself vulnerable to learn.
And added to that, can you speak more to recruitment of underrepresented groups, strategies for improving that?
Sure. Well, I think that in and of itself will help when people get to know who you are, because you have to realize that if you're talking about recruiting underrepresented groups, there's a history of being taken advantage of, and they see you as a researcher, whether or not you look like them or not, right? You represent a university, you represent this other entity that has not engaged in equitable practices with them, so they're not interested. And the other piece that I think that no one wants to mention is that the research that's come out about them or their children or their practice is often negative. Why would I want to sign up to have my child participate in a study for you to then say, see, these children are behind, they don't do this, they do that, they're aggressive, they're right? And so if you want to talk about recruitment, you have to talk about, again, forging relationships. And so families, caregivers, teachers, they need to know that you feel that you're doing work, honestly, that aligns to a strengths-based orientation. Many will close the door on you because they think you're just another researcher here to do a deficit-oriented research. So increasing recruitment is not just about showing your face, but it's also having a very different frame of reference and how you approach individuals to participate in your research, and that you view them as experts, and that you want to partner with them and do work that is about building the positive developmental context for their children or for the children they serve. So that's a big thing. I mean, there's other things you could talk about, is obviously going to spaces, whether there's researchers, you think about where your population goes, where do they spend a lot of time? Those are places you want to recruit. So if you know that you have individuals that attend religious school, then that's on the weekends, and that's a place you want to go to increase recruitment. If they're participating in particular extracurricular or sports, or just basic things like, haircuts, those are places you can go to recruit. But I think it begins, for the most part, with a sense of valuing and respecting your population and showing that in every way in which you interact with them. That increases recruitment.
So there's a question about how a lot of funding often targets findings that low-income children have worse academic outcomes than their higher income peers, which is the impetus for work that is based on deficit frameworks. How do we reframe that or address that in a different way? And I think we talked about this earlier, but Dr. Cureton, you've mentioned, I know during our conversations, around how policies can often be framed around risk and need. And so can you talk a little bit more about that?
Yeah, so I sympathize with the person who's raising this question, because it is hard for us to come as scholars to come in with a non-deficit point of view when the very nature of the grant application is set up so that the first thing we have to do is identify a problem and name something as a problem. So in that instance, I can't tell you what to do, because that is because we as scholars can't change how the funding agencies, the federal funding agencies in particular, sort of write their RFPs. Now, one thing that I will say is that in the foundation world, what I have found is that foundations are not as deficit-based, if not at all. The many of the foundations who have funded my work are not deficit-based at all. And what they actually want is a strengths-based perspective. And I really feel that it is within that foundation funding world that scholars of color, and also scholars who are focused on positive strength-based research for BIPOC communities, can actually have a vehicle to support their work, right? And having said all that, I think, though, it is a real issue for us when we're looking at sort of our government funded RFPs and how the first thing you have to do is state the problem. One thing that I can tell you that it is a true thing that one of my senior mentors told me a long time ago. It's going to sound a little funny, but this is the way he explained it to me, is sort of like, well, you know, you kind of have to do what it is you need to do in order to get the grant. So in that opening paragraph, if they want you to describe it in terms of it's a problem, you sort of have to play the game. But what he said is that what you want to do when you're designing your study, when you're collecting your data and when you're analyzing things, you don't have to summarize your results in that way. You don't even have to frame all of your questions from this deficit point of view. So his whole idea was that basically you can take that information, right? His whole idea is that you can take the funding and use the funding to help you develop measures and use measures with populations that you're interested in. And then as you go forward and produce studies, you can ask questions within those studies that are not deficit-based. Now, this is something that he told me once, you know, offhanded about a way to do it. I don't know. I've never been successful at doing that, so I don't know if that can work for you either. But I think that it's a really, really bigger question, you know, for us as scholars in terms of how do we sort of in that federal policy, that federal grant making sphere, how do we get them to change their point of view? I don't know.
So in the interest of time, one last question. There's a lot of great excitement about the access tool, wanting to know how do people get their hands on it. Stephanie, do you want to end by giving an update on the status?
Yes. So I should, hopefully, when I get off this call, I'll be able to open my email and have a book contract set up for the access tool. And we are hoping to sort of get the manual and tool published by by the fall, you know, I would say, so that people would be able to sort of learn more about the nitty-gritty of the tool, and then also be able to start scaling up sort of the trainings for people to be able to use the tool. So more to come. And then this is the last slide where I just want to say thank you for your time. This was so fun, and we feel so honored to be invited to sort of share our knowledge and our expertise here, and to be able to talk about some of the research values that we have, you know, at Riser. We encourage you to stay connected. We have a Riser affiliate network where scientists can, sign up to be part of our affiliate network and sort of get our emails where we share announcements, we might share papers, we might just share general news. It's just like a listserv in which we use to communicate with each other, and it's open to any scholars, and we welcome you to be able to join that network. And this is, if you have any further questions, you can email me and our team at BU using seed@bu.edu. And then the two Twitter accounts that we have here is our Boston University Seed Twitter account, and then we also have Dr. Aruka's Twitter account from FBG that is at FPG Institute. So we thank you for your time, and hopefully this is helpful, and I wish everyone good luck on their grant applications.